The Children's Health Insurance Program requires an immediate change and immediate action to be taken. The the program needs to change from um, from where it requires a certain poverty line in order for children to be able to access it. Health insurance has to be available to all children regardless of the income that their parents hold. Another recommendation that I want to see in the Children's Health Insurance Program is the need for it to become the Citizens Health Insurance Program. That way, every U.S. citizen is able to access health insurance coverage that they need, even if they're not able to afford it, or regardless of how much money they make, they still have the ability to tap into this healthcare and not have to pay for private health insurance programs or copays. This change would allow beneficiaries to access quality healthcare without the obstacles of meeting income requirements. This type of change would allow for members of disadvantaged populations to access the healthcare coverage that they need without having to worry about being able to afford it, and therefore would allow them and enable them to be able to focus on taking the necessary steps to improve their situation now that they do not have to worry about their health care and their healthcare needs being met. The life expectancy and mortality rate of Latino and African American children is being determined by whether they're able to afford health insurance or not. Latino children and African American children make up 53% of uninsured children in America, even though they only make up 43% of the underage population. The program was created in 1997 as a result of the inability of disadvantaged children to access health care. The program grants a budget to the states to extend their coverage to the children who previously were not able to access health care because they could not afford it or their parents could not afford it. The most common reason for children not being insured in Texas is often seen as the high cost of health insurance and the language barriers that the parents often face when they have just moved to Texas from out of the country. Uninsured neonates are also 2.6 times more likely to die than their insured counterparts. So health insurance does determine whether a child is going to live or die in our country. Health insurance for children and for citizens, is the responsibility of everyone and should not be allowed to be determined by their income.